Okay, I'll share my screen. We'll get started.
Okay, wonderful. Thank you.
Okay, as usual, we have the case presentation, and I'd like to share stories about patients we've worked with in the clinic and just give you some insight in terms of how we approach some complex medical issues and how sometimes very complex issues can be treated in a very straightforward manner. So we talk about a person that had recurrent angina. Angina means chest discomfort, a sensation of tightness, heaviness, or pressure in the chest area. Usually, it could be the upper part of the stomach, it could be the jaw, it could be the neck. And this patient underwent the usual medical treatment, which is surgery. So it's a 39-year-old female with the heart failure. So the heart was at a point where it was weak. It wasn't working committed to the body's needs. They also had anemia. The person had the uterine fibroids, sleep apnea, and they presented to the clinic with left side chest discomfort. So the person had lots of medical problems. She underwent bypass surgery in 2022, so this was roughly 3 to 5 years. And she had severe blocks in her heart. 3 arteries were bypassed with grafts at the time. And the way they do bypass, you see this diagram, this is the aorta, the main artery coming from the heart. They'll connect a vein from your leg from this artery to an artery here, usually past a narrow, we call it bypass. They'll bypass a narrowing of stenosis in the artery. So they may do this multiple times, maybe 3 or 4 times, bypassing 3 or 4 narrowings. And so she, after the surgery, began having more chest discomfort. Was concerned that the other arteries were blocked up again, quote unquote. Her chest pressure was occurring daily at rest, so this is pretty severe. Lasted several seconds at a time, sometimes minutes, I think. Also occurred with exertion, at which time it was coming by short stretch. So she's clearly having symptoms related to poor circulation of blood in the heart. And so she came to us for further evaluation. At the time, she was on several medications. These were of the typical medications you treat someone with heart disease. Carvedilol, a beta blocker, which helps control blood pressure, relax the heart. The Cinepril, which is we call it angiotensin converting enzyme. This medication relaxes blood vessels. It's supposed to reduce pressure in the heart. Hydrochlorothiazide, diuretic, again, 3 blood pressure medications. She was on Repatha, which is an injection medication to reduce cholesterol, along with atorvastatin. Many of you familiar with this drug is a statin drug, which reduces cholesterol. Aspirin, quote unquote, thins the blood, along with clopidogrel. So, despite being on 3 blood pressure medications, her blood pressure 174 over 102. Heart was still slightly weak, pumping on at 48%, should be about 55 to 70%. Cholesterol was high despite being on 2 cholesterol medications. She was pre-diabetic, lots of inflammation, and this molecule, LPA, is an LDL-like molecule that predisposes to clotting and could cause a heart attack. This is mildly elevated. So what did we do? Well, we started out by putting on an excellent diet, plant-based diet, food level 0 to 6. She had about 50% raw foods each day. Avoided processed plant foods, no potato chips, oils, dyes, and sodium. We started her on a special infusion. It's called Plaquex. It's phosphatidylcholine. This infusion helps open up plaque arteries. It helps remove plaque from arteries along with the diet. The diet also reduces inflammation, opens up the arteries. And external counterpulsation also opens up the arteries. Now, these 3 combinations work in synergy. They work together to not only open up isolated plaques, which the bypass surgery does, but it opens up all the arteries. It heals the arteries inside from all the tiny little microvascular arteries that you can't see the large ones that you can see. So this treatment is a systemic treatment of arteries, not only in the heart, but all over the body, the brain, the GI tract, the extremities. So it's like a healing process of the body's arteries, vascular system. So circulation not only improves in the heart, but also throughout the body. Blood pressure is reduced, inflammation reduced, and the body starts to heal and feel better overall. It's important to understand that because the body works as a system. If you work on one system without the other, you may get some improvement here, but if you're not getting improvement here, this system can't help this system. And if you're not working on this system can help. But if you have a treatment that works on all the systems get stronger together. And they not only get stronger individually, but they also get stronger to help each other out. So you create what's called a positive cascade of events. And so that's what's happening here. So if you were to take a treatment that creates a 1+1 effect, then okay, maybe you have two, or maybe a 4+4 effect. But this has a 4 to the power of 4 effect, or 10 to the power of 10 effect, because the synergistic aspect of it creates a cascade of events, and so the benefits are not additive, but they're not even multiplicative. They're to the power, certain power up, and the more you apply the treatment, 10 to the 10, 10 to the 20, 10 to the 30, 10 to the 40. That's the power of this kind of therapy, as opposed to 1+1 + 1. So the results in just 3 months on dietary plant-based diet, gradually the frequency of chest circumference went down. It was gone after 2 months. And this is at 3 years. A bypass surgery. Had a chest cracked open, saw it open, and was back in the same position. She was going backwards. Inflammation went down. She could go up 3 flights of stairs easy, where she couldn't do. She had chest pain at rest. Blood pressure went down. Inflammation went down by 50%. Total cholesterol was reduced. Heart was pumping stronger. And to see all of these numbers improve significantly in the results. She was able to reduce the cholesterol significantly, allow her circulation improved, increase pumping function, maintain lifestyle, remain on unprocessed food. Someone with high genetic risk for doctors recommend to do these therapies plus others. Now, we're also able to wean medications. Typically, someone like this can come off medications. That wasn't indicated here, but when I see these patients, I wean them off medication very rapidly because the body's getting better in a very rapid manner. So this is just a situation where a patient can do very well. And it doesn't take a long period of time. People think that lifestyle changes take too long. It takes too long. No, it's actually faster and more effective than a lot of the other treatments. I'll rest here. You can bring everyone in. You can raise questions. We'll address any and all questions.
Could I see the before and after blood work again?
Okay, I'll do that.
And everybody, if you have questions, please raise your hand. And questions about the presentation, or perhaps other questions?
So there you go.
Okay.
Before and after.
So the HSCRP, does everybody know that that's a reduction in her overall inflammation? LVEF.
That's the pumping function of the heart, the ejection function of the left ventricle. So went from 48% to 6%, 25% improvement.
That's wonderful.
So heart got stronger.
And did she consume food from the garden kitchen?
Um, Probably didn't specify that in the presentation, but she never did some.
What was the EF before and after?
Well, we didn't see the one before. They didn't give me the one before her initial surgery, but this is the one after her surgery when she came to us was 48%. After our intervention, which wasn't surgical, it went up to 60%. Sometimes the ejection rate goes down after surgery due to the stress of the surgery.
And so for a patient like this, she's had, a wonderful results. How does she keep these results?
Well, she got to maintain the lifestyle
Mhm.
with the nutrition, exercise. We have people come back periodically for infusion therapies, maybe quarterly or once a year, twice a year. It depends on the overall situation, how they respond. We'll follow up her in a few months, see how she's doing. To the extent she stays compliant on a regimen, these numbers will continue to improve.
And so if she goes back to standard American diet, she would lose these gains, yes?
Very well could, yeah. She
Yeah.
goes back and again, it's the lifestyle which is the problem first and foremost. So the problem isn't heart disease or whatever. The heart disease is a manifestation. The problem is the lifestyle. So the poor lifestyle is the disease. So if she goes back to disease, then she's back with disease. Stay away from disease, out of disease. It's like if if you're plunging house horse manure and somebody pulls you out and gives you a shower and you smell good, and you say, well, if I go back into horse manure, will I smell like horse manure? Yes. It's not it's the horse manure or
Mhm.
the mud, whatever you want to use.
All right. So Kevin asked the ejection fraction before and after.
Yeah, 48% before, after 60%.
So she went from not good to perfectly normal. Yeah.
Yeah. And this could have gotten worse as she stayed on the poor lifestyle.
Now, if you have questions and you don't want to be promoted to the stage to ask your question live, you can ask a question in the chat like Kevin did. Please do um, ask a question if you have one.
Did she do any other treatments at the clinic?
Those are the main ones, the ozone and the Plaquex. She may have done some sauna also. Those are the main ones she did.